Ladies and gentlemen, a very good afternoon to all of you, and thank you for joining us in this session. My name is Pam, and today I have with me to join us in this session two very distinguished guest speakers. First of all, of course, Dr. LAM Ching Choi, who is joining us by virtual means, and I have right beside me Mr. Leung Wing Mo. So to kickstart the session, I'd like to pull up a polling session for all of you. So I have a polling question which will appear on the screen very soon. And so as you can see the question, it reads, are you aware of at least one way in which you have contributed to big data collection in your daily lives since the start of the pandemic? A, yes, B, no, and C, not sure. So please answer away, and we will wait for the polling results to be in to further discuss the results later. So today, Dr. Lam and Mr. Leung will discuss with us their thoughts on digital social innovation in the realms of new insights that could be gained from the COVID-19 pandemic. So let me first, of course, introduce our distinguished speakers. Dr. Lam is a non-official member of the Executive Council of the Hong Kong SAR government. Dr. Lam is a specialist in pediatrics and community medicine and is currently the Chief Executive Officer of Haven of Hope Christian Service. Under his leadership, Haven of Hope Christian Service is one of the pioneers of elderly care in Hong Kong. Dr. Lam serves as the chairman of the Elderly Commission to advise the government on related policies, and he's also the supervisory board member of the Hong Kong Housing Society. Welcome, Dr. Lam. And Mr. Leung, he is a former assistant director of the Hong Kong Observatory. He's currently the host of a very popular science TV program. While working in the Hong Kong Observatory, Mr. Leung was the first professional meteorologist to host TV weather programs. He was a member of the Commission for Climatology of the UN World Meteorological Organization. Mr. Leung is actively involved in environmental issues in Hong Kong, and in particular, he is appointed to various advisory bodies of the government, including the Council for Sustainable Development, and helps to formulate the long-term decarbonization strategy in Hong Kong. So welcome, Mr. Leung. Do we have our polling results in at the moment? All right, we can see them on the screen. So to answer this question, we see that a large majority of our audience, 75%, says yes, they are aware of some way that they have contributed to big data collection in their daily lives, and just 4% says no, and approximately 20% not sure. So to discuss more on the topic of big data and how it's changing our lives, especially during the COVID pandemic, and how it's changing the healthcare landscape in particular, very delighted to invite Dr. Lam to share his thoughts with us on this topic. Dr. Lam, please.
Thank you very much. And sorry that I can't join Pam and Moser, we call him Moser, and in the site. And right now I'm in the hotel, but I'm not doing my staycation here because I'm hosting another webinar in this hotel. And many people saying that this COVID-19 pandemic is might be the worst time in their lives, maybe in their life, or when they encounter this, they see it in a negative way. But if we are talking about changing the healthcare landscape, and especially in the area of big data, and also in the area of technology, it might be the best time. So I would like to share with you my view on how big data is changing the healthcare landscape. And there are three major trends for sustainable healthcare, I believe globally, but at least in Hong Kong. And especially after this COVID-19, many countries, cities, and areas like Hong Kong will have budget restraint, and whereas in the past we can just use money to solve most of the healthcare problem, like Hong Kong, we pull most of our money, the public money, into our hospital system for the past 20 to 30 years. And but now when we have a bottleneck in our budget, so we need to rethink how our healthcare should be reshaped so that it is sustainable. And there are three trends which I would say in the post-COVID-19 world will be what our coming healthcare system should do and should follow. First is the medical social collaboration. In many places like Hong Kong, medical sector and social sector are well segregated. Basically, they run in silo. And when the money is not a problem, obviously we don't need much collaboration. If there is any problem in the medical sector, if there is any problem in the social sector, they just solve it by financial means. But now, when the COVID-19 comes and finance is no longer a solution per se, so we need to build a synergy. We need to collaborate more to make sure that the medical social interface is in place. And I would say this this interfacing is very important because while in aging society like Hong Kong, elsewhere too, we are facing a burden of chronic disease. So more and more people aged, and more people are having chronic diseases. And chronic disease won't stay in the medical sector or in the social sector separately. Chronic disease will push more people to the hospital, and after discharge, they need long-term care. And all these long-term care are usually provided in the social setting. So if we really need to manage our chronic disease well, even till the end of life, we need to collaborate. And I would say this COVID-19 is a golden opportunity to force both sectors to collaborate and to build synergy. And the other trend is preventive primary care. Obviously, as I said, this has been well underfunded in most of the countries, of course in Hong Kong too. And even when there is a system of primary care, the system is not primarily built for prevention of disease. Rather, it is curative primary care, just like in Hong Kong. We have a lot of primary care doctors in Hong Kong, but most of them practice basically for treatment, so not for prevention. So how we should rebuild, reshape, and re-engineer our primary care system so much so that it can be preventive. This is very important, especially in the aging population in this trend. The final one is use of technology. And the use of technology will be one of the major solutions for the coming burden of the chronic disease. And I will elaborate this more. And another good thing about technology is technology doesn't work by itself. Technology works closely with what I just mentioned, the medical social collaboration. Technology can promote, facilitate the collaboration. And technology is very good in helping us to build a preventive primary care system. So, so technology will be a big thing. While we are talking about social enterprise, social innovation, And I personally believe that technology will be one of the big areas. And of course, there are many different kinds of healthcare technology which can help our healthcare system, no matter it's telemedicine, medication management, or even 3D printing, a lot of things. And healthcare system is very receptive and very good in using the technology. But we are not as good as other industry in utilizing the power of big data. And so today I just using the last few minutes to share with you my thoughts on how to use the big data to reshape our healthcare landscape. And everybody knows healthcare system, basically we are talking about patients, individual patients. A patient doesn't mean that it must be very sick. Can be an ordinary citizen. As I just mentioned, we are preventing them from getting the sickness. So, so while we are talking patient, there are a lot of things happening in that individual and generating loads and loads of data. And all these data are very helpful in no matter no matter form you can think of. It's helpful for the government to make policy, helpful for the academia to do the research, helpful to the hospitals, how to deliver the service, and then drug companies, a lot of things. So, so data is the key. But the point is how we harness the data and use the data and digest the data into useful information. I just quote example of wearables. You know, nowadays many people are using various kind of wearables. The common thing is the watch and stammeter, or as I like to cycle a lot, and every weekend I believe I generate tons and tons of data on my cycling, because I'm tracking my power, tracking my heartbeat, tracking the routes, tracking everything, the cadency. And so how useful are these data, apart from just getting some batches from the social media? What else can all these wearables make? And when I say they are very useful. In Hong Kong, we are just holding the German Technology Expo and the Summit. And yesterday I visited a booth, and there are a lot of display of various kind of wearables. And the newest wearables is a pen, very tight pen, and with sensor, and it can accurately detect your gauge, analyze your gauge, and it is very useful no matter it is for sportsmen, for doing exercise, or even for a dancer. But it is also very useful for stroke patient, for rehab, and even good for diagnosis, and these can be the consumer products very soon. So nowadays we have a lot of wearables which can help us not only to share all the activities with your friends, but to help our healthcare system. And I just want to stretch our limit a bit. The healthcare system is, we're not only talking about doctors and nurses. We have a lot of people affecting our health, like our insurers. While we are buying our health insurance, is our insurance company rewarding our sick behavior or rewarding our healthy behavior? And apparently it is the former right now. And how can we use our insurance product to promote health, to reward those who don't smoke, who do exercise, who eat healthy diet, and who manage their chronic disease better. And I think it's a big topic. And if we stretch our imagination to our social entrepreneurs, all this data, how we link and connect all this data, not only with our doctors and nurses, physiotherapists, to our insurers, or even to the supermarket who are selling us food. And if we can form an ecosystem, and the whole ecosystem is built in a way and using our data in a way that can promote health. And many people may not know that just building a simple feedback system, a loop, where a person using a wearable, feed in the data to a person, and then give and transform that data into information and feedback to that individual. Just a simple loop of feedback can help very much in promoting the healthy lifestyle. And all the data and all the studies show this. So I would say there is a huge potential in utilizing all these wearables and converting them into health information. And of course, there are a lot of problems, a lot of hurdles, privacy, how we will this change the business model, as I said, change the business model of the insurance company, change the business model of our fitness industry, and how can we promote people not only doing exercise in the gym, but in their ordinary life too? And how does this affect the chronic disease management program? You know, now we might go to see our doctor for simple diseases like hypertension and diabetes, maybe once in 3 months. And that particular doctors can only get one single snapshot data, no matter on the blood sugar or the blood pressure. But how about I'm feeding my physician with daily data, even hourly data? And will those who are responsible to take care of my chronic disease knows better? And with the help of AI, and will that physicians or that nurses can make a better choice for me, can adjust the drug more frequently, or even tailor it down? And how about my fitness instructor? If my fitness instructor know all our data, all those data, can they help my doctor to better manage my own health and better manage my chronic disease, my hypertension or diabetes? There are a lot of room for us to maneuver, but of course I know it is not easy, and so I believe a lot of social enterprise can be built around this area. And my last word will be on the population health. Of course, I myself as a policy makers, and all these data have tremendous meaning to policymakers, to the government people, how to allocate the resources, how to make sure all our programs are really impactful and have good outcome, and how we stratify our data in different districts or even sub-districts, in different age group, in different location, and in different settings, and all these are very, very helpful. And I would say now our government may not have this luxury in assessing and digesting all this data with the help of AI. And if one day and we can have all this data, we should be able to make better policies. And finally, and I know the government is working very hard on this, and first by building a patient portal, and now our hospital authority, which run all of our public hospitals, have developed an app called HA Go, and I just have this in my iPhone months ago, and there are a lot of data in it, amazingly. And after your follow-up, you can you don't need to queue up to get your medicine, and you can just use the app and manage your own prescription. So a lot of things, and also by eHealth, later the patient portal will have a lot of your own medical record. So what I want to say is it is a blue ocean, and if our innovators and our technology developer, they can harvest all this data for us, it will be good for the individual and also good for the society and the government. Thank you very much.
Thank you, Dr. Lam. Thank you, Dr. Lam, for your sharing. That was very insightful. And I do feel that it is very important, especially in this day and age when we're looking at post-COVID times, to really leverage on technology, the role of technology in our lives, and really how to put big data best to use. So with that, I look forward to further discussions with you in the panel discussion later. So now as we move on to Mr. Leung's session, I would like to first again post you all, ladies and gentlemen, with a second polling question. So you can see on the screen, the question reads, have you changed your perception towards the urgency of climate change during the COVID-19 pandemic? A, yes, my sense of urgency has increased. B, yes, my sense of urgency has decreased. C, no, my sense of urgency has not been impacted by the pandemic. Or D, not sure. I haven't given this topic much thought. So please vote away. And as we've wait for the votes and to come back in, I just probably want to ask Mr. Leung a quick question. I know you have a very popular TV program that's on air every night, basically, and I just want to know.
Not every night.
Not every night. Well, I always see it.
Thursday, and
Tuesday,
Saturday.
Thursday. Okay. Well, I just want to know during, for example, can you introduce this program a little bit, and perhaps did the topic of your program change with as COVID-19 pandemic progressed?
Yeah, as the name suggested, Mo Observatory. Mo is my name, yes. Observatory, because I work in the observatory for decades.
Yeah.
So the initial idea was to come up with a program to sort of educate the public about weather phenomenon and how to make good use of the data of the Hong Kong Observatory. But as time goes on, I think I can add more value to that program by discussing more scientific topics that is related to our daily life. So I hope by conveying more science information to the general public of Hong Kong, we can all become more objective. We can all discuss all societal issues in a more proactive, more, engaging manner and so on. So that is the position right now.
Yeah, I think that's a really good effort in terms of really reaching out to the public with concepts related to climate change and really getting the public involved. So we can see the polling results are in, and so we can see that approximately close to 70% actually has said that their sense of urgency has increased. That's very encouraging. And we see that approximately just 10% says the sense of urgency has decreased. About 16% says, I'm not sure, my sense of urgency has not been impacted. And the remaining approximately 10% haven't given this topic much thought. So I think this is then a good time, if I can invite Mr. Leung to speak to us more about the topic of COVID-19 and probably what this has to do with climate change. Mr. Leung, please.
Thank you, Pam. The polling result is actually very encouraging that all of us, or most of us, get something out of this COVID-19 crisis. Unfortunately, I'm not going to talk about big data, which I know very little, if anything at all. And also, I know not a lot about COVID-19, so I'm sure Dr. Lam will correct me if I said anything wrong during my presentation. So the title or the content that I'm going to discuss is the connection between COVID-19 and climate change. I'll talk about that black swan. Oh, it's not working. Oh yeah, okay. So the left-hand side of the slide is about COVID-19. We all know that it's coronavirus, probably carried by bat and then pangolin, and then enter into our lungs and then get us all into all this kind of trouble. So this is a biological phenomenon. And then on the right-hand side of the slides is that we start with the leftmost top corner, which is that we have a lot of greenhouse gases, carbon dioxide, methane, ozone, and so forth and so on. They are very selective in absorbing energy. So sunlight is basically transparent to them. They don't absorb any energy from sunlight, but they absorb the energy emitted by the earth after being heated up by the sun. So that is the reason of global warming, because that kind of energy emitted by the earth should ideally be radiated back to space without raising our temperature. But right now, because of the presence of these greenhouse gases, so to speak, the world gets warmer and warmer and warmer. And so we have the world melting world. This is, of course, exaggeration. But the consequence is that on the bottom right part of those slides is a radar picture, which I take from the Hong Kong Observatory. So this is a normal radar picture, but I twisted it into something like a whirlwind in the upper top part of the slides. So this is a sort of visualization or illustration of how rising temperature can do with our weather systems, which is all weather systems now, as we experience it, are twisted in one way or another. Today is the 20th of November, is that right? But if you walk out to the street, it appears to be sometime in spring. It's warm and humid and so on. So these are my understanding of COVID-19 and climate change. So it appears that they are not really related. One is about the biological world and the other is about the physical world. But if we, next slide, please. If we take a look, going back, please. It's not working. Okay, good. Okay, it's a little bit complicated in the slides. We have the climate change at the center of the slides. And then climate change, obviously, a lot of people know that it will cause a lot of heavier rainfall, rise in temperature. I'm talking about the upper part of that slide. And that will increase the habitat of mosquitoes. And that will affect, I mean, a lot of people being bitten or maybe perhaps even contracted with various mosquito-borne diseases like malaria and dengue fever and so on. So this is the kind of connection between the biological world and the physical world as we know it. But going to the problem of COVID-19, the relationship or connection is a little bit more subtle. If we go to the bottom part of this slide, you see a lady with the word biodiversity. What the message I'm going to convey is that the climate change, the phenomenon of climate change, actually cause a lot of changes in the biosphere, which is actually an important part of the climate system. As a matter of fact, the United Nations issued a special report last year. It is about the threatening of the biosphere. A lot of species becoming extinct now, as we speak now. And also that situation will become worse as a result of climate change and so on. So we have an aspiration to keep the temperature rise of the world to within 1.5 degrees Celsius. Now, what is the point of climate change affecting the biosphere? Well, there is a concept called dilution effect. And Dr. Lam would probably correct me if I am wrong. Meaning that if we have a rich biosphere, then the chances of a insect or whatever carrying certain pathogens affecting human being will be much less than if the biosphere is sort of threatened in a certain way, like what we have right now, because forests are being destroyed, animals are dying, and so forth and so on. So this is what we call the dilution effect. So some scientists actually say that the COVID-19, the phenomenon of COVID-19 is actually related or partly driven by climate change destroying our biosphere. So you see the connection there. And then the other connection is that because of changing climate and we don't get enough food and so on, and people are sort of malnutrition and they do not have the immunity they are supposed to have, so they are more vulnerable to climate to COVID-19. So this is the yeah. So I mean, we have a famous saying from Churchill. How should I describe it? Never waste a good crisis. So that was what Churchill said many years ago. I mean, during the Second World War. Well, COVID-19 is definitely a crisis. It is very impactful. It caused a lot of pain to a lot of families. But if we don't get any lessons out of COVID-19, then I mean, all those people who suffer will be suffering in vain, right? So from this slide onward, I'm going to talk about a few points that we should learn from COVID-19. Ain't no black swan. Then I refer to my first slide. Black swan is an event which is not predictable but high impact. So COVID-19 is definitely not a black swan, nor climate change. The lower image is actually Bill Gates giving a talk in TED 5 years ago, 2015. And in his talk, he said that what he was afraid was not a nuclear war. He was afraid of an unprecedented pandemic affecting the whole world. So you can say that he's someone who tells the future. Obviously, he didn't know that COVID-19 is coming, but he digested a lot of medical information, and knowing that, because scientists have been saying that it's not when, it's not if, but when such kind of pandemic will occur to the whole world. So scientists have been warning us about that. And then on the upper part of this slide is Mr. James Hansen, who worked in NASA many years ago. He's of course retired now. He is giving evidences in the Congress in the US about the threat of climate change more than 30 years ago. And that two graphs, the red one is the actual temperature of the world, and the blue one is the forecast produced by a very rudimentary model of Dr. James Hansen. So you can see that even for 30 years ago, science is pretty good in predicting the future trend of temperature and also the threat of the rising temperature. So this slide actually tells us that it is important to recognize that any conclusion drawn by the scientists should not be taken lightly. Because if we take the advice of the climate scientists, I mean, 30 years ago, we are in a much better position now. If we take the advice of the medical experts about the possibility of a worldwide pandemic, then probably we can avoid this COVID-19. And then, well, the next one is that disasters respect no borders, and then the left part is about climate change, and then the right part is about the countries affected by COVID-19. And then the third story or lesson we should learn is about freedom. Trade a little of your freedom for the greater good. The left-hand side, the little girl, I like that very much because she's wearing a mask. And the shirt says, "I love Paris." Paris is particularly important in the sense that 5 years ago, there was a climate summit held there, and all countries in the world agreed to take actions against climate change. And then on the right-hand side, of course, those rich and famous live a lifestyle that they have lots, I mean, they can sacrifice a little bit of their freedom. And then the whole world, the climate situation should be much better. And then flattening the curve is something that during the COVID-19 crisis, the medical profession have been saying a lot about that, is to restrict the number of rise of cases of COVID-19 to within the capacity of the healthcare system. On the right-hand side of this slide, we have an analogy. Temperature is rising, but we don't want it to rise to beyond 1.5 degrees Celsius for very good reasons. But because of sake of time, I have to rush. And then the fifth one is that a lot of people are saying that we should not deal with climate change in a very urgent manner because it costs us a lot. Well, as a matter of fact, studies have been done every now and then that the cost of taking action against climate change is actually much, much less than if we don't take any action, and then it will cost us a lot of money when the climate change deteriorates, the climate deteriorates. The right-hand side is that about countries taking a lot of active actions and the suffer in GDP. And then probably the last one is that the vulnerable people are the people that hurt the most. So we should, I mean, when we judge the COVID-19 situation, we compare with climate change, and they share the same thing, that the poor people, the underprivileged people are those who are hurt the most. So there's an ethical dimension in that. So I think finally, I'm going to stop here, which is that as suggested by Pam, I have been running that program for 2 years, and sort of get to me that every one of us is a script writer. I wrote a script for Mo Observatory, and by writing the script, that script could be a story of hope and happiness, but it could also be a story of suffering and doom. It's all up to us. Thank you.
Thank you. Thank you for that insightful sharing, Mr. Lang. And I mean, very reflective of the polling results we got. We got the 75% who are increasingly aware of the climate change in relation to COVID-19. So I think your talk adds very much to the explanation to how this relationship has been built. I think to start off the panel discussion question, I'd first like to delve into the topic of collaboration, because I do believe, I mean, in all sectors really, we're talking about the importance of cross-sector collaboration, both in, for example, when we talk about using technology in healthcare, but that might also involve, say, the business sector in terms of providing technological services, and of course crossover with the technology sector. Then that also, the data can eventually, of course, inform policy. So I just want to see your thoughts on the importance of cross-sector collaboration at the times of overcoming the challenges brought by COVID-19 in your respective fields, and if there are any challenges that we must be aware of in terms of encouraging cross-sector collaborations, especially in the field of involving social enterprises. Maybe I can invite Mr. Lang to have some comments first.
I cannot comment on COVID-19 because I have to leave it to Dr. Lam. But as far as climate change is concerned, definitely collaboration is the key word. It's not about it's not just about international collaboration, which is I mean, in 5 years ago in Paris summit, we have. Everyone have very high expectation of that summit, and it turns out that all countries agree to that. But it's very unfortunate that USA withdraw from the Paris Agreement. That is a real setback, because weather and climate knows no border, as I just described in the presentation there. So collaboration is most important. But if we zoom into Hong Kong, collaboration is also very important because the government alone cannot deal with whatever aspiration that we're going to have. For example, we are talking about decarbonizing Hong Kong and decarbonizing the whole world by 2050, which is only 30 years from now. That is a daunting task. So everybody has a chip in. And I think in that aspect, social enterprises can come into very active play because they mobilize people, they know a lot about the societal problem and so on. So I agree with you that collaboration is a key word for climate change.
Dr. Lam, do you have any views in particular for the importance of collaboration and the potential role of social enterprises in overcoming COVID-19 crisis?
Absolutely. And I think Mr. Leung shouldn't understate the importance of being an observatory man in fighting against this COVID-19. Actually, those participants from Hong Kong may know that we have 3 KOL, and all of them are from the observatories. Very interesting. And 2 previous directors, and especially Lam Chiu-ying and also Mr. Leung himself. And 3 of them are very important KOL in Hong Kong. And I just want to tell you a little story about this fighting against COVID-19 and with these 3 KOL. And as I just read one of the questions by Erwin, and he stated how we can do this in the climate where the trust level towards our government is so low. And so whenever there is a low trust level towards or low trust level among the whole societies, no matter towards the government or towards whatever parties. And science is our cornerstone. So we are very grateful for Lam Chiu-ying especially. And he make very useful comments on just some open data, as I just mentioned, the big data. And he make comment by drafting some curves and analyzing some open data. And all these are very important because all this kills a lot of conspiracy theories and kills a lot of nonsense. You know, in this COVID-19 pandemic, a lot of different theories, a lot of fake news, a lot of misguided comments can ruin all different efforts in fighting against this disease. And so all these science people, every day they work in the observatory, they read the data. Sometimes they may make wrong forecasts, but basically they are making their forecasts according to the data collected. And all these are science. And if our society forsakes the merit of science, I don't think no matter it's a pandemic or our economy or whatever, all our systems will collapse. So we are very grateful. And at one time, actually, I want to reach out for one of these KOL in science and to make stronger comments and to shape the sentiment of the public. And so I would say collaboration is very important. And so even observatory people can contribute in this fight against COVID-19.
Okay, yeah, thank you, Dr. Lam. I would also like to just invite both Mogor and also Dr. Lam to comment on the importance of digital social innovation and what role this plays, because after all, today's session, the theme is on digital social innovation. So in your respective fields, do you see a role for digital social innovation? Do you have any examples, remarkable examples that you could cite for us of how we can best leverage on the role of digital social innovation, particularly during the times of COVID when digitalization becomes so important?
Dr. Lam, let me respond first because I don't have an answer. That's a short question. I can't once again I can't comment on COVID-19, the use of digital innovation and so on. But as far as climate change is concerned, obviously digital innovation is important. But I think it's not about the basic climate scientific data. I cannot think of any way where digital innovation involved in the general public can contribute to the understanding of the physical aspect of climate change, because the requirement of data is very stringent. You have to be really trained for that. And we have a lot of sophisticated instruments, for example, satellites, which can provide us with an awful lot of data. So as far as the basic physical data is concerned, then I think it's all taken care of by the government, by the Hong Kong Observatory, by the weather authorities worldwide. But I think innovations in other aspects can come in to help. For example, if you're talking about the impact of climate change to the biosphere, the biosystem in Hong Kong, then we need a lot of this kind of collaboration so as to help the scientists to understand the whole picture better.
Thank you, Mr. Lang. Dr. Lam?
Yeah, and digital innovation obviously is very important in the field of healthcare. And no matter it's COVID-19 infectious disease or chronic disease, digital intervention, especially by the social enterprises, is very important. Especially as I just mentioned in Hong Kong, we basically follow the British old system of administration. So we are running our government and the public policies and public service in a silo manner. And so there are very little cross collaboration, cross discipline, multidisciplinary. All these are very difficult to build among the public services. So not to mention how to bridge education with healthcare, and even when we are talking about chronic disease management, a lot of departments who are pretty much not in the healthcare field are making even bigger impact on the general health of the population. Say housing, say transportation, say our leisure and cultural department, and our food management related bureaus and departments. All these contributes to the general health of the population, especially in the aging population. But unfortunately, our government is not very good in building bridges, collaboration among all these policies areas and departments. So the civic society should come in. The social enterprises should come in. They are the better bridge builder. And they can massage the data from various departments, and they can make meaningful information out of all these, and they can pull different people together. And as I just mentioned, the example of fighting against COVID-19, if we have people like Mogor and Lam Ching came in to help us being our COVID-19 KOL, maybe we can, our battle may be a bit easier. So social enterprise should be very much promoted in this area. This is what I believe. They are better people in a better position to put people together, and also sometimes to put resources together too.
Thank you, Dr. Lam. So on that note, Dr. Lam, you mentioned the importance of course, efforts from the civil society. So in a sense, I guess this is also important to stress that when we look at change, making change, impactful change in the society, especially for the better good of the society, it's not only just a collaborative effort, and we cannot just rely on top-down efforts, but also bottom-up efforts are extremely, extremely important. And on that note, I just want to use a little bit of time to explore into the area of citizen science, and probably because I'm aware that actually the Council for Sustainable Development recently published the long-term decarbonization strategy, a really big step forward. And I just wonder if Mogo, you can slightly elaborate on or introduce this report or the strategy. And within the report, I see also there being efforts from individual behavior or at the level of the civil society that we can also contribute to making changes in the long-term decarbonization strategy, such as low carbon lifestyles. Can you elaborate a little bit more on that?
Yes, certainly. First of all, a little background for that report by the Council for Sustainable Development, because China, of which Hong Kong is a part, has an obligation to produce what is called the National Determined Contribution to Carbon Reduction in Carbon Emission. So we should have a certain roadmap to decrease the carbon emission in Hong Kong. So that is our obligation in terms of our international commitment. That is the background for SDC to take up this initiative. Because one special characteristic of the work of SDC is that it's bottom up. Because for many years in a row, starting with charging for the plastic bag and so on, we engage a lot of discussion with the public. So that is no difference for the long-term decarbonization strategy. So it comes up with lots and lots of recommendations. And of course, we have to decarbonize the production of electricity, which is the majority of carbon emission in Hong Kong. We have to talk about educating the public, because as I mentioned, we need collaboration. The government alone cannot do it. We have to rely on the effort of each and every one of us as well, and so on. So there are, 30 or more recommendations by that report. And based on that report, the government is going to produce a roadmap for decarbonizing Hong Kong. That should be coming in the middle of next year, 2021. So I think it is something that every one of us should take a little time to read it and digest it, to see in what way we can help. As you just mentioned, as an individual, changing our lifestyle can actually help quite a lot. So
yes, thank you, Mogo. I think on the same topic, I'd also like to ask Dr. Lam for your opinions, because we're talking about sort of the role of each and every individual. And in your talk, you also, of course, focused on technology, big data. I would like to ask you for your opinion on the role of social media you see in big data. I wonder if you can probably comment on how much contribution social media has to that big data collection you've been talking about, and how can we ensure the reliability of such data?
Oh, yes. Thank you, Pam. And actually, I would like to respond to your question also with some questions in the Q&A I just read, and about some on the privacy, and some on how we can use the public data. And especially while in Hong Kong, we have pretty low trust level towards different government departments. And I think, to me, the answer is in the society. As I said, is in the civic society. Actually, everybody is generating a lot of data. We don't really need to totally rely on the government data. Of course, the government is the biggest institution in the society, holding the biggest number of data. But if in the civic society, we can collect those data, including the social media, as just mentioned, by a third party, which is basically built by the social enterprise, and that means it belongs to the people. So it's for the people and belong to the people. And these kind of so-called big data center in the community can actually help a lot. And say we have a lot of individuals being cared for by different NGOs for whatever reasons. Some are old people with chronic disease, some are just having dementia, and they are having their blood pressure record every day, basically. And some of them are self-record. And and as I just mentioned now, I'm a keen cyclist, and I believe there are thousands of cyclists recording their data every day. And I believe all this data, if being collected and then analyzed by our data scientists, they will be very useful for that particular community. And for example, just a simple thing, accidents. There are a lot of accidents happening, and accidents does contribute to a significant mortality, and also have sometimes lifelong effects to those youngsters. And a lot of these accident data not only belongs to the government, can be collected by different people. Quoting myself as an example, cyclists track a lot of accidents. And so if we can pool all this big data together in this civic big data center, run by the social enterprise, being trusted by the people, by the general public. And all these can feedback to the policymakers, to the district council, to the local government departments, how to improve the road, improve the market, and how to keep the community safe, and also feedback to our health policymaker, how to allocate the resources, how to reshape our social services. There are a lot of things can be done. So my answer is, if we are not going to do this among the government, we can do this in the community. So I will pose this question back to our social entrepreneurs and innovators.
Thank you, Dr. Lam. We do have some questions from the audience that we can read. I think Dr. Lam has actually addressed quite a lot of them. If I think we can go to the next question to see that the audience has posed for Mogul. So the question reads, early prevention is very important and cheaper than the disaster results, like wearing a mask, health monitoring to prevent chronic disease. But how can we encourage people to do it? Is there a model? So I guess in essence, the focus on prevention of disaster.
Well, if there is a model, then I don't think the model works, because you see, there are lots of examples, particularly in the Western world, that people put their own individual freedom above everything else. So that's why in one of my slides, I suggested that we sacrifice a little bit of our freedom for the common good. I think in that aspect and another related aspect, one important thing is that we should appeal to our own conscience. I truly believe that, like our great teacher said in thousands of years ago, that everyone born is with a good heart, kind-hearted, so to speak. So I think is about education, is about not challenging those people who maybe perhaps do not wear the mask, but try to influence them in a more friendly way, try to sort of emotionally involve them. I think that would be, because even in Hong Kong, we see a lot of incidences in the social media that a lot of people are not wearing masks and being scolded by a lot of people and so on and so on. That kind of confrontation is the least we want. I think is we have to appeal to our ethical mind, our conscience.
Thank you, Mogol. Thank you. So in light that, of course, Dr. Lam has answered many questions from the audience already, I myself have a question. I have a question for you, Dr. Lam. So basically, we're talking about, of course, putting big data into good use. And of course, you are Chief Executive Officer of the Haven of Hope Christian Services. I just wonder if there are any good examples you can give us in terms of how the Haven of Hope Christian Services is actually using big data at the moment?
At the moment, I would say the very minimal. As I said, we don't have the infrastructure for collecting and analyzing the big data, and but we really want to go into this. And since most of our services are situated in Tseung Kwan O, which is a very captured community with around 400,000 people living in an area basically either surrounded by the hills or the sea. And so this will be a very good community if we can collect the data. And actually our services are holding many of those data. As I said, we are serving quite a significant amount of numbers of elderly people and handicapped people in our areas. And also we have a network of Chinese and Western clinics, and they are also generating tons and tons of data every day. And we are in the process of tidying up all this data and try to build a system for different IT systems to talk with each other, and then we will try to get some funding. Funding obviously is very important to build a local big data center, and then hopefully we can collaborate with other organizations, no matter it's a healthcare or social care or even other neighborhood associations, and to collect some minimum data. And then we'll have a very good data set, both for community diagnosis and for ongoing surveillance and for whatever use. And so this is our plan. And hopefully other districts can follow suit afterwards if it is successful. So this is our dream.
Thank you, Dr. Lam, for sharing that with us, your vision in terms of using big data. Very encouraging because I can hear a very comprehensive plan.
Sorry, Pam, can I add one more thing?
Sure.
And you know the government is building a network of district health center.
Yes.
This is what I just mentioned, one of the trends in building the preventive primary care. And this is basically the responsibility of that district health center to monitor the district health. That means that center should have this capacity, as I just mentioned. And hopefully with the collaboration between the government, who is the funder, and the NGO, who is the operator, and the communities and they are the users, and they can build effective infrastructure to collect the meaningful data. And so what I just mentioned is just our dream, and hopefully we can work with the district health centers to make this into a reality.
All right. Thank you, Dr. Lam. So in closing this session, I think I'd leave the last words for conclusion remarks from our distinguished speakers today. So if I can invite Mogol first, would you like to make a concluding remark?
I'm not prepared for that. I wish everyone good health. And I mean, that COVID-19 is really causing us a lot of pain, a lot of depression, mood, and so on and so on. I hope we can all recover from that. But at the same time, don't lose sight of a probably much larger crisis. And that is, of course, climate change, because what we are experiencing right now is probably a dress rehearsal of what is to come as a result of climate crisis.
All right, thank you. Dr. Lam?
Yeah, and social distancing is one of the major measures we use over the world in fighting against this spread of COVID-19. And technology, and also technology being used by a lot of social enterprises and innovators will be an antidote to the effect of social distancing. Social distancing has caused a lot of problems, not only in the field of livelihood and also economy, but also on the mental health. And so a lot of people are separated, lonely, depressed, frustrated. And so I also appeal to all those participants who are active in building the social enterprises. Please utilize the advantage of the technology to help those because of the social distancing. They might feel lonely. They might feel not connected with other people. So please, and let's join hands together and especially to care for those disadvantaged groups.
Thank you, Dr. Lam. So on that note, I think I will close this session with, again, thank you to both of our distinguished speakers, Mogol and Dr. Lam, for their insights. I think the theme was very well covered in terms of highlighting the importance of collaboration, in the importance of bottom-up approaches, and the power of our citizens in really contributing to tackling crises together, hand in hand. So with that, I'd like to close this session. Do continue to support the SES Summit. It's ongoing, and I think after this session is closed, there will be an evaluation questionnaire highlighted on your screen. So I'd appreciate you, ladies and gentlemen, if you can just use the QR code to fill in that quick questionnaire to let us know your thoughts about this session and the summit. Thank you. Thank you all.
Thank you very much.